movement that is that has a global impact. That being said, I'll be your moderator for the day. It's a great honor to be once again back with the Techfugees community and to help and to support the amazing projects that are being done in the healthcare sector, and that is targeting the healthcare for refugees, which is often overlooked and often under-delivered. And I think we are now live. We are streaming this video, and this is this pitch on the 17,000 Facebook page, that 17,000 followers that we have. And I think all of them are looking with eagerness and interest to your project. So thank you all for joining us today as projects and as viewers as well. And just to give more context to the pitch, Techfugees since 2017 is far more than a typical NGO that you can hear of, or a typical humanitarian approach. It's refugees and it's refugees and tech and all there is between them. And it has more than 7 chapters globally, all across continents, and it tries to push for more a humanized approach of technology, and where it can serve the purpose of increasing the quality of lives of refugees globally and not regionally. But we're not only working to refugees, but also with refugees and building solutions together, and to building them hand by hand in supporting each and every one that is interested in the field, and trying to empower them through training programs, connections, and far more beyond that. I wouldn't talk for long. I'll leave much more floor for other projects and more interesting projects that are much in demand with the rough days that are living right now, with the increasing numbers of refugees globally. Next to our project, we have ACU, which is Assistant Coordination Unit, which is a Syrian national, non-governmental, non-political, and you guessed it right, also non-profit organization, which is much focused on coordination and trying to maximize the effort of the international community that is trying to help refugees. And I think it's a very interesting project where it focuses on trying to amplify the efforts that are being put into assistance for refugees, and at the same time is trying to push forward much more coordination and supporting of the technical, the assistance, and working also with the community representatives. We have Qasim with us today to help us to see the project much more in a deeper lens, with explaining to us the amazing efforts that they are doing on the ground and how it can play an important role in supporting the local community. Qasim, the floor is yours.
Thank you so much, Ahmed, for the nice introduction. Hello, everyone. My name again is Qasim. I'm from Syria, and I've been working at ACU for several years. And Ahmed, if you allow me, I would like to share my screen.
Yeah, sure.
Just a couple of slides to make, a bit like appealing to the audience. Okay. Okay, so in terms of the ACU, as Ahmed said, we are a non-profit, non-governmental national organization. We are registered in Turkey in 2013, and we are working to amplifying the efforts of different actors, donors, and to make sure that the assistance is delivered well to the IDPs, host communities in need in northern Syria, both northwest and northeast. In this regard, to that end, we are trying to focusing
Awesome.
on.
Just one simple
Yeah,
demand
please,
from the
go ahead.
audience to share it in full screen so it can be
Yeah,
seen.
okay, let me just start sharing again.
Yeah. We just love your slides. They're amazing, and
Thank you.
we would love to see them in full
So,
HD.
is it any better now?
It's the same for us.
The same, still the same?
Yeah. Yes. Yeah. Maybe you can click use slideshow.
Yeah, I already did. Just let me check.
Yeah. Maybe you can close the
How about
share
now?
and share it.
How about now?
Yeah, perfect now. Perfect.
Perfect. Okay. So thank you.
Perfect. Perfect.
Thank you, Ahmed. So we are trying to make sure to provide a better life for all Syrians after the Syrian crisis in northern Syria by coordinating among different donors, different actors, and by providing concrete, accreditable information and data to all actors on the ground in northern Syria. And for this, we are now having like 900 overall workforce. Like 75 of them are working in Turkey, which is the central level or the headquarters, and the rest of the team are located in northern Syria. This map shows the intensity or the density of the coverage. As we see, we are more covering the northwest since we have like larger population in that area, and we are covering all the areas none held by the Syrian government. It means whenever any let's say sub-district, community, or a camp is none covered by the ACU, let's say by the Syrian government, we are trying to reach it. At the early stages of the ACU establishment, we were covering also Damascus, Homs, Al-Ghouta, and the southern side of Syria. It means all the besieged area as well. This map shows the density of the camps in northwest Syria, and currently ACU covering like 600 out of the 1400 of the camps registered by the CCCM cluster, which is a cluster which is responsible to manage all the camps issues and support and assistance. The ACU partners, it differs from the political, let's say, bodies to the non-profit organizations, to donors, to the Turkish authorities. And as we can see, the top partners are the UNICEF, OCHA, WHO, CDC, of course, the EU, the French MFA, Save the Children, etc., and some tech companies for sure, like Google, Microsoft, and so on. The ACU scope, it covers different types of sectors, starting from the health, which is focused like more to increase the health of Syrian people and to decrease the morbidity and mortality in northern Syria. And we are also covering the immunization, the malnutrition surveillance, food security, wash and sanitation, and economic empowerment, and the information management unit, which produces different types of products and information services. I'm going to talk specifically about the health, since the purpose of this session is the access to health. and share with you our experience in terms of health. The ACU established the EWARN department, which is the Early Warning Alert and Response Network, by the support from the CDC, which is the Center of Disease Control and Prevention in the US, and by support from WHO and UNICEF. And we are working closely now for like 9 years with UNICEF, with WHO, and some international and local organizations. For now, for example, we have like weekly or bi-weekly presentations at the WHO to review all the surveillance information. It depends on the let's say the disease. For example, for the AFP, we have like a weekly review session with WHO experts, and we are covering different types of surveillance in the EWARN system, starting from the passive surveillance. On the ground in Syria, we have like 500 health facilities reporting to us across like 9 years. Passively, we don't have to go to them to ask them or to remind them to submit their reports. They willingly submit their reports, and these reports include information about 13 diseases, and it is disaggregated by age groups and sex groups. And for example, if we hit the link here at the WBD, which stands for waterborne diseases, it will show like a dashboard shedding the light about the diseases related to water, like acute diarrhea, STF, suspected typhoid fever, acute bloody diarrhea, water bloody diarrhea, and so on. The other type of surveillance we are covering is the case-based surveillance. ACU has detected 2 outbreaks in poliovirus in northern Syria. Syria, it was like in 2014, the first outbreak was detected by ACU, and then in 2017, another outbreak related to poliovirus detected in northern Syria. And Syria, until now, it's close to have like polio-free, very soon. Until we have like 3 years of surveillance without detecting any wild poliovirus cases. And in terms of the COVID-19, ACU through EWARN has started surveillance on COVID-19 and lab testing. We have now 6 labs in northern Syria. They are doing the PCRs and the rapid diagnostic tests to diagnose and to detect COVID-19. And by clicking the link, the hyperlink of the COVID-19, you can access to like a weekly update on the cases detected, the number of deaths detected so far. I'm gonna share you in the next slide a success story about COVID-19. And another kind of case-based surveillance is the vaccine preventable diseases, mainly focusing on measles and rubella detecting, and also let's say there's like side events or adverse events treatment or management. Also, ACU are taking care of it. The other kind of surveillance is the event-based surveillance. Whenever any let's say outbreak or cases reported from the ground, and these diseases are not listed on the 13 diseases we are currently covering, immediately the field staff started to report to the central staff through phone or through emails or WhatsApp or whatever. And then let's say that the verification and the management of the alert and the outbreak starts to deal with the alert. Another kind of surveillance, or let's say it's more like response, not surveillance, the vaccination. ACU has a team which is seconded to the SIG, which stands to Syria Immunization Program or Group. Half of the SIG are from ACU, and they are working on both the campaign vaccination and the routine immunization. Currently, the routine immunization are delivered through 100 post centers in northern Syria. A third of them are covered by ACU, And by clicking on the dashboard, you can see like a bit of details about, the vaccination figures and stats. Another type of surveillance, which is the malnutrition surveillance. We are working mainly in northwest of Syria in terms of the malnutrition surveillance. We monitor the nutritional status of the children, and we are doing some tests and measures to make sure that the children are not like suffering from deficiencies and other type of malnutrition effects, let's say. And of course, all these information, dashboards, data sets are nothing if they are not shared to let's say the humanitarian community. That's why ACU always makes sure to upload the data through the HDX, which is the Humanitarian Data Exchange, which is a joint platform that most of the humanitarian actors submit their data and report on it. A brief about the tools we are using. As you see, we have a plenty of the tools, which is, kind of overwhelming. However, in coordination with WHO, we are trying to use, let's say, all-in-one complete solution to handle all kinds of data management, starting from data collection, cleaning, analysis, and finally, visualization and presentation. Now we are conducting a pilot by using DHIS2 to track and to monitor all the routine immunization in northern Syria. And also we are using GoData system, which is provided by WHO EMRO in Jordan. And this system is used to track the COVID-19 information. And also we are using a platform called Activity Info to fill, let's say, a piece of the puzzle of the entire region to have like a bigger image about the COVID situation in the EMRO region. And honestly, till now, we are lacking, like the best solution to manage all the data, let's say, pillars of the E1 department. Hopefully, we are kind of optimistic to find that DHIS2 is like the better solution. Until now, we are piloting this system with support from WHO. Some of the concerns and brief experience through the years. As you may know, there's like fragile infrastructure inside Syria. Most of the people lacking the access to internet, and the internet is bad in some areas. That's why we are kind of, like struggling in this regard. However, ACU managed to deliver some equipment, some devices like sometimes internet connections, satellites, sometimes mobile phones, the laptops, depends on the level of the field team. We mostly we have like two levels of the field team, like the frontline users, and then like let's say supervisors or the senior level of the field team, let's say. And honestly, till now, there is no governance system managing, the different sectors of work, especially the health system. There is now no stable health information system. ACU trying to coordinate with WHO, with the health ministry in the Syrian interim government to provide a health information system, to contribute to this system, to make coordination among the different health facilities, the different health directorates inside Syria. And hopefully we will have support from like maybe from Techfugees, from other partners who are interested in support IDPs, who support people in need in such, let's say, war afflicted areas. And I'm going to share with you one of the success story related to COVID-19. EURN managed to deliver the lab results of COVID-19 to all patients within 1 day. Can you imagine? Although we have like bad infrastructure inside Syria, we managed to track to make the testing or the lab testing, then clean and analyze the information. And through some scripting using Python, we managed to get the data from this system, which is Go data system, and then we managed to send it to all patients who are waiting, the lab results for them. Some of people inside Syria, whenever they want to move from one controlling area to another or to cross the border between Syria and Turkey, they are asked to show the lab testing. So ACU was, eager and keen to provide the lab results within 1 day. I mean, even in the developed countries, they are not, somehow able to provide the lab testing within 1 day. So with like few resources, with let's say very limited resources, we managed to do that. And recently, within like the last 15 days, we had a presentation in the global system of Go data, like globally, to share our experiences. And we presented our success story to them, and they were very excited about it. And another thing I would like to mention that ACU now is facilitating and hosting 3 platforms. The first one is related to the Syria legal platform. The next one is Syria education platform, and the final one is water station platform. These platforms are kind of, let's say, coordination bodies that ACU invites people and organizations to meet, to have like a table, to open space to talk, to discuss all the problems, and to find, let's say, the solutions, and to convey some messages to donors and to actors. It's worth mentioning that ACU also, through the WASH department, is responsible of encoding the entire water stations in northern Syria. Whenever any organization would like to conduct any response, they have to contact ACU to get like an assessment about the situation in that area, and to get their water stations coded and included within the system. And of course, this is under the supervision of the WASH cluster of the UN. And finally, ACU always welcome any kind of partnership, any coordination, any cooperation with tech companies, with donors, with, let's say, humanitarian organizations who are interested to increase and to enhance the well-being of refugees, ITPs. Thank you so much for listening to me for so long. I hope I covered most of let's say, the interesting points related to health. And I'm very pleased to answer any questions. And maybe my colleague Khalid will talk a bit about using the technology and the success story of ACU in terms of using some tools and utilities. Back to you, Ahmed. Thank you so much.
Thank you so much, Qasim. It's a very interesting work that you do. And I would also highlight one of the points that you mentioned, that you will deliver COVID results in 1 day through a WhatsApp message. One of my friends that stays in a EU country actually received his lab results in 10 days in paper form through the regular mail. And you have done such an amazing job. I congratulate you on putting all of the main players and international players together. I think that there's a huge organizations that failed in doing that, and you have done an amazing job. So I congratulate you. MashaAllah, shababna fihum khair. That's what we say. And I always see that there's where there is a will, there is a hope. And I see that you are all young, and you are on the very early stages and on what you are doing. And I think there's a huge room for enhancement and opportunity for work. MashaAllah, great work. I'm really proud to be moderating this session with such projects to see. One question from the audience is, when it comes to medical data, what are the security measures to put in place regarding data protection, especially that it's something that is very sensitive, and it in a way it can be dealt in, especially in the MENA region, with much higher sensitivity. What's your take on that, Qasim, Khalid?
Okay. Khaled, if you let me start about answering this question. In terms of the, let's say, the medical data and the sensitivity and confidentiality of this data, ACU has kind of, let's say, MOUs with the health facilities inside Syria. Okay, we are receiving the let's say, the reports from them, but we are keeping, their names and the facility names as well, like censored, and we are not sharing this information even with WHO. We have like coded the entire list of health facilities. So when we share our data with WHO, with partners, we make sure to share it like with codes, not with the real and plain names. This is one side, and of course, when we are, let's say, whenever any researcher or academic institution or organization wanted like very detailed information, there will be like an agreement, to specify the condition that how they can use the data to make the reference if applicable or if needed. And also we might ask permissions from inside Syria, from the health facilities, if we'd like to disclose their names. This is one side. And of course, even when we share the dashboard, I don't know, maybe some of you know that when you show the underlying data, sometimes it gives you some like very detailed information. So we make sure that we are not sharing even in the underlying data any like sensitive information. And we are sharing the data mainly with WHO, with UNICEF, since they are experts and they are, let's say, driving the access and the response to health. So we have some agreements and, let's say, working closely with them to specify the kinds of sharing and the level and the granularity of data to be shared. And of course, Khalid can talk about the backups and the security taken in the server when we are collecting the data to our servers. Khalid, if you'd like to add any comments on this.
Yeah, thank you. Let me first introduce myself. My name is Khalid. I am the IT manager in ACU since 2014. I will add to my colleague Qasim about the security and data protection. We are trying to protect our data. Actually, since 2015, we have like, I will share my screen. We have a partnership with Microsoft and Google, where we, sorry, I will share my screen again. Okay. So since 2015, after struggling many times with our IT infrastructure, we were using our on-premises server, and as you know, operating on-premises server has high cost and has many issues. So since 2015, we started partnership with Google and with Microsoft to migrate all our IT infrastructure to the cloud. So we are using Microsoft, for example, Microsoft Azure. We are hosting all our applications and servers on the cloud. So we have the highest standards in the industry regarding securing our data. And even Microsoft recently in 2020, after using their services for 5-6 years, they published this article on their website. I will share the link with you, where they published an article about how we are using the Microsoft Azure, and even because we received like generous grant from Microsoft as a non-profit organization. So we are using their infrastructure to host our applications. And you can have like overview how we are using their services like Power BI, like Microsoft Office 365 and all Microsoft services.
Thank you, Khalid. It's really amazing.
Yeah,
Do you want to continue?
Actually, I don't know if there's time, but I think it's enough. If
Okay.
you have any questions, I'm ready.
It is truly remarkable on migrating into cloud services. As I mentioned before, I think that there's a lot of advanced economies didn't do that, and it's a truly smart move, and especially in terms of data credibility and data safety. And I think it's a really smart move. Moving on to the next question. Um, are there any like we all know that there's some areas that are impacted by the war in Syria and the conflict, and slow connection is something that is a bit common in the country, and um, is USSD an alternative to the internet-based messages? Is this something relative, or is this question set properly, Khalid, or do you think that's it's something not related?
Actually, we are, as Qasim said, sometimes there is like areas, there's no like internet connection. We are providing satellite connection to that areas, but I don't know what is meant about USSD.
Yeah, let me
But-
jump in, please, to answer.
Yeah, okay.
Yeah, I think he's referring to using the messages systems to submit reports. If you are talking about disease reports, in some countries, they are using like internet-based systems to submit the reports through messages. Okay, so in Syria, we are not using such systems. We are using mainly WhatsApp, Skype, and some other chatting tool to communicate, to manage, the work. In terms of data submission or report submission, mainly we are using the systems themselves. Like DHIS2, there's like a mobile version, and also on GoData as well. There's like a mobile version where the front user can submit their reports, and also email. Sometimes we are receiving the reports through emails, like using like classical, let's say, kind of reporting, like using Excel sometimes. It depends on the area, especially in the eastern side of Syria, where we are working now in low profile, like because there's insecurity in that area. So our field staff, working somehow undercover or in low profile. So they are collecting the data at the field. When they go back home, they fill the form, the electronic form, and submit it to us. I hope I answered that.
Amazing. I'm a technical. I have a technical background, but sometimes when it comes to deep security issues, I seem to feel falling behind. One last question from the audience. Whenever that we see successful projects, it is a common question. Are you planning to scale? Are you planning to replicate this kind of efforts in other countries? Or is it focused on Syria right now?
Khalid, may I?
Yeah.
Actually, now it's focusing on Syria. Since we are trying to, let's say, until we have like solution to the Syrian crisis, to provide like a dignified life to our people, then we are able to replicate, let's say, our experience. And in fact, actually, right now we are sharing and contributing, to the global experience. For example, in WHO guidelines, they added that ACU through the UN department, they used WhatsApp as a success story to manage the connection and the communication in such, let's say, bad infrastructure areas and in the war-afflicted areas. So we are sharing our, let's say, experience data as well. We are sharing our data to the academic institutions so they can conduct researches. For example, in Berkeley University, we have a partnership, and we conducted 2 researches so far, one related to measles surveillance across like 5 years, and the other one related to the relation between the attacks on health facilities and the morbidity, let's say, norm and trends. And Khalid, maybe you'd like to add anything to this?
Actually, as you said, we are the Syrian crisis today is like maybe the worst crisis since World War II. So I think there is a lot of need to expand our coverage inside Syria first.
Yeah, definitely.
So we try to cover as much as we can. Actually, we are trying that, but we need more partnership, as you said, as you see through my Qasim presentation. We have a lot of partners, but we still there's need for more partners to cover more, to expand our services. So I think maybe in the future we can replicate our experience to another country where we, let's say, have some kind of stabilization inside Syria.
And if
Yeah.
you let me, Ahmed, to add just one more comment.
Yeah,
I don't
briefly, we're a bit behind time, but I'm enjoying.
I'll make it quick.
Yeah.
Sorry. I don't know if you, some of you are familiar with the UN agencies. When you are dealing with them, sometimes, you know, there's like a turnover, like high turnover. So whenever any focal person you are dealing with, like, let's say, move to another country, so a new guy will come, and maybe you are forced to start, you know, reinvent the wheel, okay? So you start again, maybe one system will, let's say, will be vanished. So until now, we lack, you know, our all-in-one solution. So hopefully, with support from Techfugees and the participants now in this session, we need a body or let's say a company or whatever that and are interested in, you know, supporting, increasing the well-being of people and the health of people in the afflicted areas or afflicted areas.
Yeah. That is amazing, and I can see the team spirit between you and your colleague Qasim, you and Khalid. You were presenting, Khalid. We're sharing links on the chat about ACU and what you do, and I think that teamwork is essential in this. And I think in all successful projects, I think that teamwork is something essential for the success.
Actually, we are together since 8 years. So we are more than colleagues, we are family, you know, because we are spending time to each other more than our families.
This is this is one of the most important aspects of working collaboratively is to have a team that has a great communication between each other, great understanding. And I always see this in successful projects and successful startups. Thank you for sharing your inputs, Khalid, Qasim. I don't know. I think that these are all of the questions that we had for you today. I also wanted to mention one of the projects that wasn't able to join us today, which is watch the Med alarm phone. As you know, in these difficult times that we are living in, and especially in the previous 6-7 years, we have seen tremendous impacts of refugee waves. But these waves has also, unfortunately, some impacts on the attitude and the response that we got. We have seen on the shows on the entry points of countries, and Watch the Med is trying to support refugees on the areas of entry and the places of entry where they support certain areas and certain people to report unfortunate incidents or report on a level to support the refugees to have safe entry to the countries that they are trying to seek asylum or seek safety. It is a very needed project and very interesting as well, as you can recall certain incidents on the Mediterranean shores. There were a lot of xenophobia related incidents, and the projects were trying this project is trying to advocate for a more decentralized approach of reporting, which is very nice to see. and to highlight. At the end of today's session, I would like to thank all of the startups that joined us today, and all of the colleagues from Techfugees for coordinating this for the amazing efforts, and the World Refugee Day. And I see these kind of events is essential to raise awareness about the amazing efforts that Arel and Khalid and their colleagues and what they are trying to do is absolutely remarkable on terms of pushing for more equality, for more better lives, and for more healthcare services on a regional, on a local level, and hopefully one day we will see a global collaborative effort. I'm very amazed by the amount of work that these kind of projects that can do with very limited resources. I congratulate you with all means and with all my heart with the success that you are doing, and I wish you all of the best. And I would also highlight that there's tremendous capacity within the Techfugees community with refugees that has skills, technological skills, and the Techfugees community has tried to build this capacity over the years, and it will be amazing to build collaborative efforts between these kind of projects and the technical knowledge that the Techfugee community has, and to see how we can build the bridges around us. You can see all of the projects links in the comments and in the chat. Please don't hesitate to visit the websites for the projects, and don't hesitate to get back to us if you have any questions, and for more collaboration. We are always open for it. Thank you so much for joining us today. Is there any final remarks, Luis? All is good.
Yes, final remark is also thank you, Ahmed, for the moderation and for taking care of organizing this session, for your insight and also your experience in the sector. So
I'm always happy to support Techfugees community. It has supported me a lot, and I'm in debt forever for the Techfugees community.
Thank you. Thank you, everybody. Have a very good day. Today was the pitch session on the health and access to health topic. We'll continue during the rest of the World Refugee Week, the series of pitch, one day, one thematic. Yesterday was information, today health. Tomorrow will be around access to education. So join us either on Zoom or on our Facebook page, and looking forward. Bye-bye.
Bye-bye. Thank you, everyone.